Hey, it's Adam Sewell, MD. Every joint tells a story, and if you know how to read that story, not just on x-rays but on a molecular level, you can tell exactly where the joint is in the degenerative process and what it needs to recover. Today I'm going to walk you through the 4 stages of osteoarthritis, not as grades of wear and tear, but as biological phases that follow a predictable signaling pattern. Let's start with stage 0, the healthy joint. Here, everything is in harmony. The cartilage surface is smooth, chondrocytes are active but calm, and the synovial fluid provides perfect lubrication. Cytokines like interleukin, 1-beta, and tumor necrosis factor are present but tightly controlled. Growth factors like TGF-beta1 and IGF-1 keep the cartilage matrix balanced, while protective microRNAs like MIR140 and MIR27B maintain collagen integrity. This is what we call a coherent signal-OM, a symphony of balanced molecular signals that keeps the joint self-repairing and pain-free. Then something disrupts the balance, maybe trauma, metabolic stress, or chronic overload. Now we enter stage 1, early inflammation. This is where the cytokines begin to dominate. Interleukin 1-beta, tumor necrosis factor, and interleukin 6 start rising in the synovial fluid. The cartilage begins to lose proteoglycans, and chondrocytes switch into a defensive mode. We can detect this long before any imaging changes appear. At this stage, treatments like platelet-rich plasma, hyaluronic acid, or platelet-rich fibrin can completely reset the signaling environment. The goal here is to silence the inflammatory pathways and preserve the regenerative ones before structural loss begins. Stage 2 is where the disease becomes visible. You'll see mild cartilage erosion and more pronounced synovial inflammation. Cytokines like interleukin 17 and interleukin 8 appear, recruiting neutrophils and amplifying catabolism. Growth factors like fibroblast growth factor and vascular endothelial growth factor drive abnormal blood vessel growth in the subchondral bone. At the same time, destructive microRNAs like MIR9 and MIR34 arise, promoting chondrocyte apoptosis. Clinically, this is the perfect time to introduce placenta-derived biologics such as PDPA or PDPC. These treatments deliver balanced cytokines, growth factors, and microRNAs that can reprogram the joint back toward homeostasis. When you intervene here, you're not just reducing symptoms, you're changing the trajectory of the disease. By stage 3, the damage becomes structural. We see deep fissures in cartilage, osteophyte formation, and subchondral bone sclerosis. The inflammatory cytokines stay high. Interleukin 15, interleukin 18, and tumor necrosis factor continue driving degradation. Growth factors like bone morphogenetic protein 2 and platelet-derived growth factor are upregulated, but now they're fueling fibrosis instead of repair. Protective microRNAs like MIR27B disappear, while MIR155 dominates, increasing cell death and inflammation. At this stage, we often combine PDPA or PDPC with A2M and PRF to create a full regenerative environment, silencing catabolic enzymes, neutralizing inflammatory cytokines, and sustaining trophic signaling. The results can be dramatic, especially when supported by PEMF and physical therapy that restores mechanical alignment. Finally, stage 4, severe osteoarthritis. At this point, most clinicians assume it's too late, but even here, there's hope. The dominant signals now are interleukin 33 and the WNT beta-catenin pathway, which promote fibrosis and sclerosis. MicroRNAs like MIR21 and MIR181 drive apoptosis and chronic inflammation. Placenta-derived biologics, particularly PDPC, can still downregulate these late-stage pathways, reduce fibrosis, and sometimes trigger measurable cartilage regeneration on imaging. We've seen joints regain thickness and function even when surgical replacement seemed inevitable. So, osteoarthritis isn't a mystery or a random process. It's a predictable molecular evolution that can be mapped, measured, and modulated. By aligning treatment to the correct stage, early cytokine control, mid-stage regenerative signaling, or late-stage fibrosis reversal, we can not only slow the disease but often turn it backward. That's the foundation of the Signal-OME model of regenerative orthopedics. In the next episode, we'll put it all together. We'll talk about the Signal-OM itself, how these molecular clusters interact, how we can silence the noise of inflammation, and how to orchestrate regeneration across the entire joint. I'm Adam Sewell, MD. This is the Regenerative Orthopedics Masterclass, where we're redefining what's possible in musculoskeletal medicine.